Joseph, Bryan and I were having a conversation before this podcast, and we were talking about the name of the podcast, The Fire Escape. And it comes from an analogy that Dr. Delon Human, who we all know and admire, shares and talks about. And he talks about how for people who are smoking, we all know how low the rates of quitting cold turkey are, how tobacco harm reduced products can really be a fire escape for them and really provide a way out, a way towards cessation. And we've seen that effective in so many ways. And today you've given us a lot to think about. And I'd just like to maybe open our platform to you, keeping this fire escape analogy in mind. Joseph, is there anything you'd like to tell the listeners, the viewers, maybe people who are looking for alternatives, maybe policymakers who may be listening to this? What's a closing comment that you'd like to leave everybody with about THR, tobacco harm reduction in Kenya?
For policymakers in Kenya, I would like to say that we don't say these things out of the blues. I'm one of the people that quit smoking I started using electronic cigarettes, but now I use nicotine pouches and I love it. I've been smoke-free for more than 4 years. And I believe that they should listen to us, people that have experience in this struggle with tobacco. For me, starting to smoke at the age of 15 and up to a few years ago, trying to quit cold turkey has not been easy. And that's the message that we're spreading for the over 4 million smokers in Kenya, that there's a different way for them to enjoy nicotine per se. So I think there's a lot of public education campaign that is needed in Kenya. There's a lot of policy reform that we can do. We're open to working with regulators to ensure that laws reflect scientific evidence and do not block access to safe alternatives. And we also would like to ask to encourage responsible reporting by the media. And journalists should report with accurate data and expert sources. That's the message I have for the policymakers.